Do pregnancy women need to exercise? If yes, how? So first, let's talk about the anatomical and physiological changes that occur in pregnancy women. So the four main major systems that are going to be affected is cardiovascular system. It will increase blood volume, increase in heart rate to make sure the mother and the fetus got sufficient amount of nutrient. The second one is their respiratory system, which going to increase in oxygen consumption and also change in breathing pattern. Next one is musculoskeletal system, where usually pregnancy women gain weight, will gain weight, and this will affect their posture and affect the weight bearing that they need to carry through their life. Last one is the digestive system. It might affect some, it can increase risk of acid reflux. So there are a few, that are the four main, there are other things, but that are the four main things that we should take into account when prescribing exercise. So second one, let's talk about the benefit of exercise in pregnancy women. So if I want to talk about all the benefit, then we are going to finish this video, I don't know, next year. Because exercise has been proven to improve a lot of things. So in pregnancy women specifically, it will help with their weight management so they don't gain weight a lot. And help with hormonal balance, also help with their normal pain during pregnancy, such as lower back pain. Improve their mood. Sometimes during pregnancy, women tends to be a bit angry, so exercise helps improve moods. And finally, the crucial one, I would say, it can improve your sleep in pregnancy women. So there's a few benefits. Of course, there is more, but there's the main benefit that we can talk about. So the third one, what is the guideline or important things that pregnancy women need to take into account when doing exercise? So always remember in your mind, during pregnancy, the goal is not to push yourself. It's just to make sure you keep being physically active. That's it, not to max out your deadlift, max out your squat. No. Okay, so, and the next question will be, Mizan, do we as a pregnancy woman need to exercise? The answer is, it depends. Do you exercise before pregnancy? If yes, then continue with it. Don't load it really high intensity. Go easy with it. Just make sure you are active. And then the second thing that I would say is the priority is to be safe. Okay, safe is very important. The most important thing that you need to keep in mind. With that being said, what type of exercise that are going to benefit pregnancy women is during pregnancy, during the delivery, during the labor. We want the woman to have strong core and pelvic floor muscle. So I would say spend quite some time for those exercise to strengthen the core and help you during labor. Okay, so that's one of the exercise. Other than that, do some general cardiovascular exercise. If you think running is too hard, don't run, just walk. If you think that's quite hard for you, you can swim. So there's a lot of things that you can take into consideration. But if you are worried about it, ask your doctor and they will clarify it for you. So those are some, and make sure you stay hydrated, recover well. Some general guideline that I can give. Exercise routine for pregnancy women. So today I'm going to show and use gymnastic ring as an example for you guys who are pregnant to train at home. Why I use a gymnastic ring? One of it, because it is easily accessible. You can do it at home, no problem. You don't need to come to the gym. You can just hang in anywhere you want and you can probably do it. So this flow is just easy. I'm just going to show you general warm-up and specific warm-up. After that, we are going to go through three basic fundamental movement pattern. The one being is the push and then pull, and then we are going to perform a squat. And I will explain the reason behind it, why we do that exercise and how to perform the exercise correctly. Let's go. So let's start with the warm-up. So I'm going to start with general warm-up, which you are just going to raise your body temperature. You can use walking, you can use your treadmill, you can use cycling. But if you don't have equipment, you can do anything that you tolerable. Okay, let's say like high knee. If you can do faster, do faster. Do it for 3 to 5 minutes. Maybe you can rest in between just to get your heart rate up. You can do jumping jack if possible. But again, if you have pain, don't do it. Change with the exercise that you are tolerable. So do that general warm-up for 5 minutes, and then we move on to specific warm-up. So we have pulling movement today, the horizontal row, and the ring push-up, and then the last one is squat. So for row, again, it's going to work our mid back, our back. So I want you to go down, and we do some dynamic stretching in this position. Drop your body down, and then up. This exercise we call it cat and dog. So drop your body down, drag your scapula down, and then push your belly to the sky. Then down. Do this around 6 to 8 reps, and then done. So for the next specific warm up for the push up, so the main muscle group is going to be the chest. So I want you to do chest opener. Easy, stand like this, and then open up your chest. Do this around around 10 to 12 repetition. Okay, that's for the second one. And for the third one, we are going to do some squats, which mainly going to involve our quads. So we are going to do dynamic stretching. So instead of just holding this static, we don't want to be static because it can impact our performance. So I want you to move it. So stretch, 1, 2, down, up, 1, 2, down. Do it for 8 reps for each side. Up, 1, 2, down, up, 1, 2, down. If you feel you are unbalanced, just use the ball. Okay, up, 1, 2. If you, let's say, because of the pregnancy factor, you may think you lose balance, and hold this, and then up, no problem. So for the first exercise, we are going to start with pulling, horizontal pulling first, which is body weight row. So again, the most factor, if this exercise make you feel painful, don't do it. Make sure you are comfortable. Another thing why I like to use gymnastic ring is because you can easily change the leverage of your body and change the intensity of this exercise. Let's say if you're saying this is hard, if this is easy, you can go lower. And if you think lower is hard, you can go higher and make it easier. So you can adjust based on your level, based on where you at. And then, so how to perform the body weight row. So it's just easy. The motion I'll show you first. It will look like this. So from this, and then up, and then slowly go down, and then up. So I want you to imagine there is a coin behind your upper back, your mid back here. And then as you go up, I want you to squeeze that coin. Okay? So again, shoulder back. I don't want you to shrug up your shoulder. Shoulder back, shoulder down, away from ear. And then up, squeeze the coin. And then slowly go down. And then fully lengthen it. And then up, squeeze the coin. And then slowly go down. So again, if you are in your third trimester of your pregnancy, maybe your belly quite big. So yeah, you can still do it because it will not affect it, because it's gymnastic ring, nothing. Maybe if you do chest supported row, maybe it will affect, but this one no problem. So you can include this in your exercise routine. So this one I suggest you to do 2 to 4 sets, around 10 to 15 repetition. So for the second exercise is ring push up. So you're going to bring your ring in front of you. Again, if this is too easy, you can go further behind, and if you think this hard, you can go up. So it will change the leverage of your body. So again, your shoulder, your elbow is aligned, and then go down slowly. Don't shrug your shoulder away from ear, and then slowly go down. Slowly down, stretch your back, and then up, and then down. Then what grip to use? Is it narrow? Is it wide? What you feel the most strongest in that position. There is no right answer to this. Which one make your shoulder most comfortable? Which one makes you feel the strongest? Okay, no problem. You want to do it narrow, go for it. If you want to do it wide, go for it. Okay, no problem. As long as you feel safe, you don't feel any pain, go for it, no problem. So this one also I would say do about 2 to 4 sets, 10 to 12 repetition. So the last exercise is squat, our lower body workout. So you are going to hold it. If you have any problem, if you don't feel confident with your balance, you need a support. So use this, and then go down and up. Okay, imagine like you are sitting on a chair, but barely sit on it. Just want to touch it and up. Okay, so sit on a chair, but back, sit, and then up. Yes. If you feel this is too easy, you can always let the ring go, no problem. And if you feel it's too hard, you can reduce the range of motion, because if you go down and then your belly, maybe it's already getting quite bigger, you can just do a half squat, no problem. As long as, again, the goal of exercising during pregnancy is to keep you active. It's not about pushing yourself to the limit. It's not about building muscle. No, it's about getting yourself active, and help you prepare during the labor. There are three main exercise for our routine for one day, for mainly focusing on strength. So the reason why I do all these things is first row. Row, as we know, for a pregnant woman, as the weeks goes by, the tendency to gain weight is high. So when they gain weight, it's kind of they are going to adapt with it by having a poor posture. So row will help them maintaining that help strengthen their back and maintain that correct posture due to the new weight bearing that need to handle. The second one is the push up. Why I choose push up is, again, when we use ring, the element of stability, the element of core stability, which is one of the important thing for a pregnancy woman, is to have a strong core during a labor. So pushing movement, for your back, for your tricep, it's a general kind of general strength, but for a pregnant woman, I would say it strengthen your core stability. So for the last one, for the squat, again, for your lower leg, which is important to have a strong quad, strong adductor, strong glutes, for you to have a quad is most labor. I will not say it's easy, but it will help. This is not the only exercise. There's a lot of exercise. This is just one of it. Okay, one of it. You don't need to like, oh, only this. No, there's a lot that you can do. The thing is, like I said, you feel pain, you feel comfortable about the exercise, do you like it? That's the most important thing that you need to take into consideration when doing the exercise. Okay. So that's it for the video, and I hope this video helped you to keep you physically active, to help, or you may know another pregnancy woman that want to exercise but don't know how. I hope this video helped. Thank you very much.